our words into actions. Let me introduce Ms. Rosa Pavanelli, who is the General Secretary for Public Services International and who was, of course, a commissioner on this important project. Rosa.
Thank you very much, Richard, and once again, thanks for giving me personally the opportunity to serve as a commissioner and for PSI to represent the voice of all health workers, all professions and jobs represented in the health sector. As a member of the Commission, we of course, I personally and PSI support the recommendation, and as mentioned yesterday, we just took our first step to support the implementation of the recommendation, launching our own campaigns that will be health as a human right. PSI committed to work within the international institution, the global community, and with its affiliates at a national level to support investment for the creation of decent jobs in health and social care sector. We will never stop fighting for the full recognition of freedom of association, the right to collective bargaining, and the right to strike for all health workers, exposing all violations to those fundamental rights, and continuing to support ILO for the implementation and ratification of all relative conventions. Collective bargaining is crucial to ensure decent wages, occupation health and safety for all health workers, fair working conditions, and remove a gender pay gap, as well as all kinds of gender-based discrimination to support women empowerment, their bigger participation in the labor market, and their capacity to contribute to the growth economy, to the economic growth of their countries through their participation to the health system. Address the needs, the planning of workplace means that we need to rethink the education system, remove the blockage to the access to education to health professions, and have programs that can respond to the needs of health workforce in each country. Migration should be a choice, not a forced decision. Therefore, we will continue to support our bilateral projects to ensure fair conditions for migrant workers and their possibility to return to their original countries. We will work with WHO to spread and to implement the ethical recruitment code and to strengthen the role under that direction. Funding public health services continuing is our main objective. We will continue our campaign because we think that public resources will be available if we only commit all together to address the broken taxation system that is affecting the capacity of our states to respond to the needs of our citizens. Closure of tax havens, reducing tax dodging, and making sure that governments control the responsibility of companies to pay their fair shares to the community and to make them accountable. Work to define structures. We will work to define structural standards, staff-patient ratios, and international recognition of health worker qualification to make them applicable to both public and private providers in order to stop an unfair competition that is driving a race to the bottom for wages and working conditions, as well as quality of services in the health sector. We will support and contribute the international and national effort to strengthen skills and preparedness for staff and health workers engaged in all kinds of emergency, natural and man-made disasters, as well as in conflict areas.
Rosa, I'm so sorry to interrupt. We will just have to wrap up if possible. We have the statement online as well. Thank you so much. It was a rich contribution from PSI. Thank you. Do you want to just quickly summarize any final statements you want to make?
Yes, my only final commitment is that in order to achieve all these objectives, we need to strengthen our capacity to build coalition in local community and civil society, because if we want to achieve universal health coverage, all actors must be on board, and universal access to all health care needs to respond to the fundamental principle that health is a responsibility of states and it's a fundamental human right. Thank you.
Thank you very much. Fantastic. Okay, I now invite Mr. Omar.